Hi, welcome back to another video. In this video, we're going to be looking at the muscles of the rotator cuff. I'll be using this anatomical model, which has the 4 muscles of the rotator cuff attached, so we can see their origins and their insertion points. So to start with, if we look at the rotator cuff, so this would be a right shoulder. So we can see the humerus here, the clavicle, and this is the glenohumeral joint. So there are 4 muscles associated with the rotator cuff. The first is the supraspinatus. Then we have the infraspinatus. Then we have the Teres Minor and the subscapularis. So we'll look at these in turn. What I will do, I'll just take off the muscles that we're not looking at so we can focus on the ones that we are looking at. So we'll isolate the muscle in turn. So here we have the glenohumeral joint. We have the scapula here, the top of the humerus. So we'll start with the first muscle, which is the supraspinatus muscle here. Okay, so the name gives it away. Supraspinatus. Supra means above. So if we just take that out, this is the spine. So when we say supraspinatus, we mean above the spine. Now, can you see there's a small depression here? So the technical term will be fossa. So this will be above the spine in this depression here. So the way we describe that is the supraspinous fossa. Okay, so this supraspinatus muscle fits into here. The origin is in the supraspinous fossa, and the insertion point on the humerus is the greater tubercle. Okay, this will be the superior facet of the greater tubercle. So this is the origin, this is the attachment. So when this muscle contracts, what do you think happens? Well, it's going to pull here. It's attached to this superior facet of the greater tubercle. Tubercle, just a bony elevation. So what it's going to do is going to pull the arm. So we're going to get something like this. We're going to get this movement is known as abduction. Okay, and the supraspinatus muscle here is responsible for the first 10 to 15 degrees of the abduction. Okay, remember, abduction, we're taking the limb away from the midline, we're abducting that limb. Adduction is moving towards the midline. Okay, so if a patient can't begin abduction, they have a problem in the 0 to 15 degrees, then probably there's more likely a problem with the supraspinatus, because as we said, that is responsible for initiating the first 10 to 15 degrees of abduction. Okay, now we'll go to look at the second muscle associated with the rotator cuff. The next muscle we're going to look at out of the 4 of the rotator cuff is the infraspinous. So let's look again at our bony landmarks. The spine of the scapula is here, supra is above, infra is below. So we're looking at the infraspinous fossa, again that depression here. This is the point of origin for the infraspinatus muscle. So let's just put that in so you can see where it goes. That's what it looks like. Okay, remember, this is the front, this is the back, so we're looking at the back. So the origin is in the infraspinous fossa, and the insertion is on the medial facet of the greater tubercle of the humerus. So you've got the superior, medial, inferior. Remember, superior, this is where the supraspinatus muscle attached. So the medial is where the infraspinatus muscle attaches to the greater tubercle of the humerus. So this is where the shoulder attaches to the arm. Now, again, we've got the origin here, insertion here. When this muscle contracts, what do you think is going to happen? So it's going to pull backwards on the shoulder. You can't really see it well here, so I'll demonstrate it. Basically, the infraspinatus muscle is involved in an external rotation of the shoulder, in addition to providing stability when the shoulder, it goes through the phase of abduction. So if I look here, let me just, right, you can't really see it. So basically, when you move back, yeah, here, that is external rotation. So you won't be able to see it. So when I flex my arm at 90 degrees and I move it back, that's external rotation. So let's see if we can see this a bit more clearly. So here, so imagine this is going to pull it back, okay? So the next muscle that we're going to look at out of the four, so remember we've got the acronym, useful acronym is SITS for the four muscles of the rotator cuff: Supraspinatus, Infraspinatus, Teres Minor, and we have the Subscapularis. So now we're going to look at the Teres Minor. The point of attachment is the lateral border of the scapula. This is the medial border, this is the lateral, okay, because it's away from the midline, or the auxiliary border, okay? So this is the point of attachment of the Teres Minor, and it attaches to the inferior facet of the greater tubercle here. So let's put that on so you can see what it looks like. So we're just gonna, here we go. So again, the Teres Minor attaches from the lateral border of the scapula to the inferior facet of the greater tubercle. Remember, we're looking at the back here. So when this contracts, this muscle shortens. Again, we're going to get that external rotation of the shoulder. Now we've come to the fourth muscle in the sits, which is the subscapularis. Now here we have the rotator cuff structure facing the front. We have the scapula facing forward, okay? So this would actually be my right shoulder. So this is the subscapularis fossa. So all of this is the point of origin for the subscapularis muscle. So let's fix that on here. Sometimes, here we go. The muscle's attached here. And where does it attach on the humerus? It attaches to the lesser tubercle, okay? And then what happens when you have the origin, insertion, when this muscle shortens, what's going to happen? You're going to get medial rotation, So external rotation, medial rotation. And again, all four muscles, in addition to providing those other movements which they're primarily involved in, namely abduction, external rotation, internal rotation, they all provide stability for the rotator cuff. So the four muscles, they are involved in abduction. Supraspinatus, it's involved in external rotation, the two muscles at the back, the infraspinatus and the Teres Minor. And we have the medial rotation, which is the subscapularis is involved in that. In addition, all four muscles working together basically hold that joint in place and keep it stable. Now, as a bonus, we'll quickly go over a few clinical scenarios where we get problems with the rotator cuff. And the most common one is impingement syndrome caused by rotator cuff tendonitis. So we have the acromion here, and then we've got a space through which the tendons of the supraspinatus comes and joins onto the greater tubercle of the humerus. Now, in people who are involved with any manual labor, mechanics, where their arms are outstretched for a long period of time, there can be some inflammation associated with their work. So we get rotator cuff tendonitis. So as they raise their arm, we will get pain here because the subacromial space, as the arm is lifted, narrows, and we'll get impingement there. So clinical significance will get pain, weakness of that joint, okay? Now, how can we examine for impingement? So there's two classic tests that we're going to do. So for example, if you passively move a patient's arm to 180, that is the full range of motion, and you allow them to control their own descent of the arm, usually there is pain or weakness associated in the between 60 degrees and 120 degrees, and this is known as the painful arc. Another one is to abduct the patient's arms, tell the patient to abduct their arm, and then move forward to about 30 degrees, and if you can see, and then turn the hand like that, okay? So this, like as if they're emptying a can. This is called an empty can test or Job's test. And now what you're going to do is you're going to put pressure here and the patient should resist. Now you'll find if there's a problem or impingement, then there'll be weakness and pain. Okay, so that concludes today's video. In further videos, what we will do, we'll go into more detail. Now that we've got the basics out of the way, we'll look at clinical significance of damage to the rotator cuff, how it happens, and also exercises that we can use to help strengthen those muscles. If you enjoyed the video, give us a like. If you haven't done so already, please subscribe. And if you have any questions, just leave them in the comments below. Thank you for watching. See you next time. Bye.